it was either Mark Twain or was it Confucius? Or was it the most quoted author called Anonymous, who said that if you find a job you love, you'll never work a day in your life. But not everyone loves their job. It can take a heavy toll. Depression, anxiety, stress, end of year fatigue, all can be linked to a job you simply hate. Being in a toxic work environment. I love my job. That's a message to my boss. I love my job. But on this World Mental Health Day, we ask, how do you then assess your work environment? When's the time to move on? There was a South African depression and anxiety group report released this week that said 60% of people surveyed would quit, absolutely just get up and leave if they could. And I think it draws a need to highlight how we align company culture with personal values, ambition, but also mental health. Healthcare leadership at Stellenbosch Business School's Professor Renata Schoeman joins me now on the line to explore mental health awareness in South Africa. Is it any coincidence that it's October that we observe Mental Health Awareness Month? But October is also the month where people start saying, I'm suffering from end of year burnout, Renata. Any any coincidence?
Good morning, listeners. Good morning, Lisa, as well. And thanks for the opportunity and the questions. I think if I can use the Afrikaans word, most people at this time of the year are fairly gatvol. But being gatvol doesn't mean you burn out. And there's also a difference between being fatigued and burnout. And we see this often this time of the year, and sometimes it's seasonal, and it's not necessarily the month of October, but it's also after a long winter. Maybe our exercise routines go down the drain. And the first thing we run to is we blame our work. But work is such an integral part of our life. It gives us meaning, and none of us love our work at all times. I'm even sure you need to do some admin, and I still need to meet someone that likes to do admin. So I also love my job. I love it, but there's certain aspects of that I really don't like, and all of us have also colleagues that can make the life difficult for us at times. But I think there is a very negative conversation going on as well, where we need to emphasize the importance of corporate mental health and the importance that organizations and leaders can play in removing toxic workplace cultures, supporting empathic work culture where we can destigmatize mental health, and even provide services that everyone in the community doesn't necessarily have access to. But the conversation became very negative, where people say, but it's my work's fault that I'm feeling this way, that I want to quit my work. But why? How can we reframe this? How can we see it, even if you don't have your dream job, even if you don't have your ideal job, that you can still find meaning in it? When I work with employees and patients, the only people I advise to quit, if there's bullying that's not being addressed, or if there's a clear mismatch in values, if your values and your organization's values is not aligned, that is not going to change. They move on. But even that is easier said than done in this current South African climate. But I think it's important that we start to
Yeah.
reframe and that we also start to take accountability for our own role in mental health.
How do you then begin to assess whether your level of fatigue, stress, burnout is based on a company or a workplace culture, whether it is an external factor like the macroeconomy, you're getting less for your rand and therefore you may not somehow see the value in the work that you putting versus what you get in a monthly salary versus what you get in a retail store, or even a domestic life, a personal life. How do you assess this is the cause for the strain that I'm under?
I think that's a very important question, because if we look at the definition of burnout, it was registered, or whatever we can classify it, by the WHO, the World Health Organization, May 2019 as an occupational phenomenon. And that is very important. You cannot develop burnout because of your personal circumstances. That is additional stresses. but it's always something related to occupational phenomenon. So we must realize that if we have stresses in your private life, obviously it has an impact on the resources that you have available to deal with the stress at work as well. And we need to address that personal factors as well. If you are tired or fatigued and stressed, that will improve after a good night's sleep. It will improve after a couple of days away from work, like a weekend or a long weekend or a week holiday. However, if it continues despite that, burnout is not going to improve with rest or being booked off from work. Burnout is a constellation of symptoms where we have depersonalization, emotional and physical exhaustion, and decreased productivity in the work environment. So you work harder and harder and harder, but actually you're less and less and less productive, and you start to distance yourself from work. You start to feel very negative from colleagues, etc. That is more telltale signs of burnout. But now, as I mentioned, just resting won't address burnout, and that is very important why it has to be identified early, and there should be active interventions, not being booked off. There should be active interventions in terms of how can the employer change the work environment? Will flexi-time help? Will a different workspace help? Maybe for some people, an open plan office is really a bad idea. Maybe for someone, back-to-back Zoom meetings is really a bad idea. And address those things and get work-life boundaries in place. So if that is being addressed, and then the employee as such really makes sure that my own personal life is sorted out, I address my personal stresses, plus I take care of myself. I sleep enough, I exercise, I eat healthy, I limit my screen time, I'm paying attention to my spirituality, to my socialization. When you tick all that boxes of self-care as well, and there's still symptoms, then it's crucial that there's professional assistance, that we seek professional help, because what we see in practice is people that think they have burnout actually already fulfill the criteria for depression or anxiety, and then we need to look at medical intervention and therapy.
So then how far has the needle moved in terms of mental health awareness in a corporate setting? Not only from a workplace perspective, but also in the consciousness of South Africans?
Esther, I am actually quite proud to say at the business school, we started with the first corporate mental health lunch hour talk in 2016, 2017. I think it was September of that year. And now, if you look at the media just this week and all the things going on around corporate mental health awareness, and even that it is currently the theme for World Mental Health Day, I think great strides have been made. And also specifically during the COVID pandemic, people really started to talk about the mental health of employees. So there's a lot of awareness. But unfortunately, there's two problems. What I see is a lot of people do the bells and whistles and the icing on the cake. You know, we have a meditation session at work. We have a mental health walk. We have, you can get Friday. We have a staff braai. You know, we have a talk here and there. But it doesn't really address the stigma. It doesn't really translate to active intervention and support for people at work. And I think that is a big gap that we still see, is that we must remember that 75% of people with mental health disorders in South Africa do not access treatment. Whether you're in the private or the public sector, it has to do with the time to go, the money to go, the access to the treatment, but also the stigma. So that is the one thing, is the icing on the cake is not the difference. You need to bake the cake difference. And that is where we still need to make strides in the employer interventions. But then the other problem is, as I mentioned earlier in this interview, is what I see where the message is going wrong, where employees and individuals sit back and say, my work is bad for me. And it's their fault I feel this way, and my work must change. But I don't want to change anything in my resilience. I don't want to put in the effort. And we need to empower ourselves and take control of our own mental health. It's a dual responsibility.
Let's talk a little bit about the concept of stigma, also about whether human capital processes, leave procedures aligned. I've known several people who said, I wish I could go away for three weeks. I want to go to a retreat for 21 days. I want to isolate myself. I want to do finger paints, and maybe there's a group session where I can talk in a facilitated manner. But in order to do so, I need to go to my boss. I need to go to HR and say, I need 21 days of a mental health break to see to myself. I don't hear that conversation much, firstly because, oh, I'm going away for 21 days. Are you going to rehab? Do you have a problem? Or 21 days, you only have 15 days of annual leave. How are you going to even leave work for that period of time? Are we having those conversations?
Maybe we must start, where does this 21 days come from? Is that because medical schemes reimburse 21 days hospitalization? Because then it's the complete wrong conversation. And it's not helping. There's two things. International research shows clearly to prevent excessive stress levels, burnout, and the development of mental health conditions, we should take frequent short breaks. You should take 1 week every 3 months of annual leave or whatever time off, if you can, if you have enough leave days. But we have such a lot of public holidays in this country that it's actually not difficult to get that if you use your public holidays correctly. But you should actually take 1 week every 3 months or 2 weeks every 6 months. But in South Africa, we have this culture, and some of it is economically driven depending on the industry you work in, if you're in mining or building or whatever the case might be, that we take a 4-week or 3-week holiday during December. That is too late. So we would need to change this, that company cultures look at leave policies to say you cannot accrue leave. You need to take more frequent leave. It needs to be split through the year, because that will also help that it isn't the issue that we all want to take leave at the same time. That is the one thing. The second thing is you can go on your 3-week retreat or mental health break or admission or whatever. What is going to change? We just said that rest is not the answer to prevent or treat burnout. You need to change your day-to-day life, your day-to-day lifestyle, your boundaries, your exercise, quit drinking, whatever the case might be, and things at the organization on a day-to-day basis should change. Not having back-to-back Zoom meetings, not starting every week with a meeting, ending a meeting, and no one actually have time to do their work. You need to change the conversation in the organization. How can we have support programs? How can we have awareness? How can we have flexibility? If we realize someone runs into mental health difficulties or at high risk for developing burnout, how can we make it possible for them to go and see their therapist maybe once a week or see the occupational therapist once a week? Instead of having someone booked off for 3 weeks, they come back, nothing has changed. They're not more resilient. They're not more equipped. Nothing has changed in the environment. And it's a vicious spiral. All research show, even if you're not happy in your job, except if there's, as I mentioned, real bullying going on or something, work is good for you. Work gives meaning. Work gives purpose. And even if you can reframe it for yourself, I don't like my job, but you know what? It still makes it possible to feed my children. That is meaningful still. Work is good for us.
Really appreciate your time and your perspective and your insight, Professor and Dr. Renata Schoeman. Thanks so much for joining us. Really appreciate your time.